One, my name is Girija Prasanna Sahu. So today we am here with a new topic, that is antifungal drugs. So as you can see that there are some fungal infection image I have kept on the slide. You can see that. Uh, आप सब लोग देखे होंगे कि ये सब जो फंगल इन्फेक्शन हमें हर किसी ना किसी को अपने लाइफ में ये इन्फेक्शन हुआ ही होगा. You can see such type of infection in your neck, in your cheeks, in your bellies. So these are the different type of fungal infection which is basically affected by different fungus. So fungal infection, we called it as a mycosis, involves superficial infection that basically affect your skin and mucous membrane. आपका जो स्किन एंड जो म्यूकस मेम्ब्रेन है वो बेसिकली अफेक्ट होता है बाय द फंगल इन्फेक्शन. So this fungal infection includes infection caused by different fungal species like Candida and Tinea, and that can cause a severe uh, fungal infection, fungal infection, which can causes even in death, even in death in case of some of the patient. If I will give an example, like in case of AIDS, there is the immune system of the patient has been compromised. So due to this, these patients are highly chance to affected by a fungus called aspergillus. So aspergillus fungal infection is very common in case of AIDS patient. So fungal species, to detect the fungal species, we have two type of staining by which we can detect the fungal species. One is pH staining, that is periodic acid cave staining. Another one is Gomori methanamine silver staining. These two staining is used basically for the detection of the different type of fungal infection. Okay, if we will classify the fungus according to the etiology, so we have two type of fungus. One is called dermatophytes and another one is called as saprophyte. Okay, so what is dermatophytic infection? This is a type of contagious superficial infection, and it is a superficial infection caused by epidermophyton, microsporum and trichophyton. थ्री मेजर स्पेसिस में इसको निमोनिक याद रखने के लिए ईएमटी याद रख लेना. EMT याद रख लेना. E for epidermophyton, microsporum and trichophyton. These three species then can causes dermatophyte infection. And another one is saprophytic yeast, which is basically caused by aspergillus, blastomycosis, candida, cryptococcus, histoplasm. Okay, next. So if we'll talk about the prevalence, so it is the prevalence of the fungal infection basically depend upon the location where you are live, the काइंड ऑफ पॉपुलेशन एंड द सेवरल अदर फैक्टर्स. देखो, चीज ऐसा होता है कि फंगल इन्फेक्शन बेसिकली कैसे होता है. इफ व्हेन ए पर्सन डजंट मेंटेन द हाइजीनिटी, that the chance of fungal infection is very much. So it is estimated that globally 25% of the people are suffering from the different type of fungal disease, from where the candidal infection can affect millions of people each year. Okay, common type of fungal infection are athletic foods, jock itch, ringworm, thirst and yeast infection. Symptoms basically common symptoms जो आप लोग देखे होंगे, that is itching, redness, swelling and pain. The factor that increases the risk of fungal infection include that weaken immune system. अभी मैं आपके साथ डिस्कस कर रहा हूँ. In case of AIDS patient, basically what happened, their immune system has been compromised. So so in such cases, the fungal infection by the fungus will be more as comparison to the normal individual. So age is the one of the factor, that is when the person get old, their immunity has been compromised. That's why the chance of having fungal infection increases. And again, diabetes, as we know that diabetes is in diabetes there is a hyperglycemia is there. So due to this hyperglycemic condition, some of the fungus get chance to uh, grow in the high sugar level condition. Antibiotic, as we know that when we take antibiotic, our intestinal microflora has been compromised. So due to that, several opportunistic infection can be seen and several other environmental infection that can cause a severe type of fungal infection. So if we'll talk about the classification of the antifungal drug, there are several type of classes drugs available in the market to treat different type of fungal infection. So first one is Polyenes class of the drug. Example is Hamycin, Amphotericin B, nystatin, and this basically site of the action is fungal cell membrane. How it acts? It acts basically binds the ergosterol and forms pores in the cell membrane. Again, to the antimetabolite class, one antimetabolite drug available is 5-flucytosine, which basically acts the upon the fungal nucleus. inhibits the nucleic acid synthesis. हेटेरोसाइक्लिक बेंजोफुरन क्लास में आपका आता है ग्रीसियोफुल्विन which is a broad spectrum antifungal drug. It basically acts by disrupting the microtubule of fungus by binding to the spindle. Okay, then in case of azole, there are two class of azole is there, triazole and imidazole. In case of triazole, the drugs are ticonazole, fluconazole, voriconazole, itraconazole and posoconazole. In case of imidazole, you have ketoconazole, iconazole, biconazole and clotrimazole. These are basically act on the cell membrane, inhibit the lansosterol 15 alpha demethylase enzyme. ये एंजाइम का नाम एग्जाम में पूछता है 15 alpha demethylase. Okay, in case of allyl amine, the drugs are butanafine, naphthalene and terbinafine. These are basically act by inhibiting an enzyme called squalene epoxidase. Okay, then Echinocandins, caspofungin, adenofungin and micafungin. These are basically act on the cell wall, inhibit beta-13 glycan. Okay, inhibit beta-13 glycan of the fungus. Okay, so this diagram indicates the previous slide, and it represents the diagrammatic representation of the previous slide. Basically, you can see that the squalene epoxidase is squalene converted to lansosterol, lansosterol converted to ergosterol, and the ergosterol helps in uh, maintenance of maintenance of fungal cell membrane. Okay, fungal cell membrane. When then what happened? The conversion of squalene to lansosterol is basically by an enzyme epoxidase, squalene epoxidase, which is inhibited by allylamines, terbinafine, butanafine, and naphthalene. Ergosterol synthesis can be inhibited by inhibiting the enzyme 15 alpha demethylase. The azole class of the drug basically act on this pathway. Then inhibition of cell wall synthesis by echinocandin, caspofungin, micafungin, and adenofungin. Inhibit the spindle formation by glycopolvin, inhibit the DNA by flucytosine, and formation of pore by Polyenes class of antibiotic. Okay, let us discuss drug one by one. So our first discussion is on Amphotericin B. As we know that Amphotericin B is a Polyen antibiotic, and this is basically given by IV infusion because of its low oral absorption, and it is having widest fungal antifungal activity. मतलब several species के ऊपर ये अपना fungal action show करता है. Okay, it sorry basically binds to the fungal ergosterol and forms a artificial pores on the fungal cell membrane, as I discussed previously. So it is the drug of choice in different class of fungal infection like meningitis, mucormycosis, and fungal meningitis. Okay, in case of fungal meningitis, the drug can given on the intrathecal route. The the major disadvantages of given of the drug by intrathecal route is, by if we will give the drug in intrathecal route, it can cause a seizure and other neurological manifestation. Okay, when you administer in amphotericin B, it can predominantly causes different type of infusion related reaction. So to minimize that, you have to take some pre-medication like antihistaminic and glucocorticoid. Okay, again the dose limiting toxicity of the amphotericin B is nephrotoxicity. ये एग्जाम में क्वेश्चन पूछता है. Okay, the major toxicity or dose related toxicity of amphotericin B is nephrotoxicity, hypokalemia, and hypomagnesemia, which can be minimized by two methods. One is by formulating liposomal and amphotericin B. Other one is by giving with normal saline. If you will give with normal saline, the nephrotoxicity issue will be reduced. Okay, then other issue is anemia, basically due to decrease the hormone erythropoietin level. Okay, next important drug is flucytosine. Flucytosine is one of the important drugs which get converted into 5-fluorouracil by enzyme cytosine deaminase, and this enzyme basically helps in the thiamidylate synthetase formation. As you can see that it inhibits the thiamidylate synthetase, several adverse effects you can see in case of 5-fluorouracil. So the adverse effect you will observe are bone marrow suppression. Next, liver dysfunction. Okay, another one is alopecia. Okay, this flucytosine having synergistic action with amphotericin B. Okay, so its activity against it is a very narrow spectrum antifungal drug. Activity is only against cryptococcus and candida infection. Okay, cryptococcus and candida infection. Okay, next is your azole class of the drug. As I told you that azole class of the drug basically acts by inhibiting 15 alpha D ethylase membrane, which will basically help in the conversion of lansosterol to ergosterol. Okay, so as I told you that it is of two class, imidazole and triazole. In case of imidazole, drugs are ketoconazole, econazole, miconazole, protimazole, and in case of triazole, ticonazole, itraconazole, voriconazole, posoconazole, and fluconazole. So if we'll talk in detail about one of individual drug, so let us start from the ketoconazole. So if we will talk about ketoconazole, okay, it is having narrow antifungal activity, narrow antifungal action. Second important point is inhibitor of cytochrome P450 enzyme. CYP450 microsomal enzyme. Okay, that's why it can increases the plasma level of several drugs like cyclosporin, warfarin, theophylline, etc. Okay, so other adverse effects are includes um, gynecomastia. Okay, menstrual irregularities, and and infertility. So which is basically due to inhibition of steroid synthesis. Okay, so if we'll talk about fluconazole, having maximum oral bioavailability, okay, and can penetrate CNS, can penetrate our central nervous system. So it is the drug of choice in candidiasis, cryptococcus, cryptococcal infection. Okay, Itraconazole. So itraconazole is drug of choice. Itraconazole is drug of choice in blastomycosis. Okay, voriconazole having widest antifungal activity. Okay, so next important drug is griseofulvin. Griseofulvin. So first and most important point about griseofulvin is it should be taken with fatty meal, because fatty meal increases drug absorption. Okay, so its mechanism of action, I have told you previously, it acts by interfering with microtubule formation.